So I want to make my class tonight as interactive as possible. So I want to ask you a question. If you look at like our traditional medical healthcare system, which does a lot of good for people, but if you look at that, and if you look at what they would advise or they would say what lifetime care is, what do you think that means in our traditional system?
Medication.
Nursing home.
Okay, so you're saying nursing home. Hopefully that's not the case with us.
Hope not.
Medication. So can you clarify that, Robbie?
Whatever their medical condition is that hasn't been, they'll treat the symptom instead of the condition.
Yeah.
Cause.
So
Thank you.
can you give me an example of that? That happens a lot. Diabetes. Okay. Yeah. Good. Yeah. So you got can diabetes okay? Let's say just type 2. Okay, because type 1 diabetes is autoimmune, but type 2 diabetes be cured? Be fixed? Yeah. Can you say it can?
Mm-hmm.
I would agree.
Yeah, through diet.
So through diet and what
Exercise.
else? Exercise. Okay. So the typical treatment though would be here's metformin. You're going to be on it forever. Okay.
Correct.
Yeah. So what about like cholesterol drugs? Same thing.
Mm-hmm.
Cholesterol drugs, right? You take this. You got high cholesterol. You need to be on this, and you need to stay on it.
Mm-hmm.
Okay. What's the problem with those? What's the problem with that?
Side effects.
Okay, so cholesterol drugs have side effects, a lot of them, okay? And metformin, that's a pretty safe drug, actually. It's not as bad as some of the other drugs that you can take. But pharmaceuticals have side effects, and they cost money, okay? And they don't fix the problem. They don't solve the underlying issue. So if your underlying issue is high cholesterol, for example, and you wanted to do some lifetime care without pharmaceuticals, what would you do?
Change your diet.
Okay, from what to what?
My brain,
Sorry, Robbie, I'm trying to put you on
my
the
brain
spot.
is so
Decrease your
fried
sugar
You can
intake.
change
Sugar
the way
intake.
change your change
Yeah.
the way you cook or eat.
Yeah,
Or,
number one would be sugar intake, okay? Number two would be processed fats. Your body takes processed fatty acids and turns and elevates your cholesterol with that. So those would be the two things that you'd cut out of your diet, okay? So here's the thing, is that the type of lifetime care I'm going to be talking about tonight is going to be a lot different than that, all right? So what is most people's approach to lifetime care? There's a lot of dogma out there that's founded on cliches, okay? So let's look at one of them. Here's number one. There's going to be 3 aspects of lifetime care. If it doesn't hurt, there must not be a problem. Now, is that good? Is that a good basis for lifetime care?
No.
Why not?
Usually when it hurts, it's too late.
Or a lot of times, yeah.
Exactly.
Okay. So one of the questions I ask on my questionnaire after the first 12 visits is what percentage of the nervous system senses pain? Nobody ever gets that question.
Isn't it all of it?
No.
The brain.
No. What percentage? It's 10%.
Oh, percent.
Yeah, 10%.
10% of the nervous system
Right.
actually senses pain. So what does that mean regarding health?
Pretty important, 10%.
Well, yeah.
But it's such a low percentage.
That's true, Natalie. It's an
Let's
important
fix that
10%.
10%.
But it's a low percentage.
Remove
What
it
do you
or
expect?
something.
So if you think about it, if what does the other 90% do? If 10% if it's only 10% that deals with pain, what does the other 90% do? It's sleeping? I mean, what is it doing?
Reacts.
What?
Reacts.
It's function. Okay? So it's like, it dilates your pupils of your eyes, or it allows you to move your arms. Talking about function, it allows your heart to beat, your lungs to work, your kidneys to work, your liver to detoxify. How many of you in here feel their liver detoxifying during the day? That's happening now, you know, I never sit down, you know. Well, we don't, okay? So the fact is that 90% of what our nervous system does, we don't even feel. So that means if only 10% perceives pain, that means that you can have a major loss of function and not even know it, okay? So that's why this doesn't fly very well. If it doesn't hurt, there must not be a problem. I mean, everybody in here knows people that have had, like, you know, drop dead of a heart attack, or they went to their doctor for a physical and found out they had stage 3 or stage 4 cancer and had no idea they had it. Didn't hurt, okay? So what Jason said earlier was right. I mean, you know, once you start getting the pain of cancer, you're really, really far down the road, okay? So here's the thing. With that attitude, if your car, it should be car, okay, does not have a seized engine, you don't change the oil, right? Okay.
No.
That happened to me, by the way, when I was a teenager.
Me too.
Yeah, and I learned a hard lesson, you know.
Yep.
Blew up the engine in my family's car.
Oh.
It was not a good day at our house, okay? So we changed the oil because we want the car to work better. And as human beings, we want things to work their best as well. So we want a new cell phone, better service, car that runs better. And so we want our health to be better too. But that doesn't mean that we always want to pay the price. So, it used to be a lot more of this. People made fun of other people who took care of themselves, Like I've been called a health nut. That's a great badge of honor, And I go, well, what are you, a disease nut? I mean,
That's right.
I mean, really, it's either or, So, and when my wife was working downtown at the Homeland Security, she always brought healthy meals, and she actually got persecuted for that. I go, why are you eating that? But the people that were persecuting were people that were sick a lot, missed work a lot, their production wasn't always very good, and she noticed that. This is one of the best things that ever happened to our marriage, because she realized that the stuff that I was talking to her about was actually true, that it worked, and it worked for the people, worked for her down at Homeland Security. So it may be true with your chiropractic care too. So didn't they fix you yet? You still going back even though you're not in pain? Well, the fact is that a lot of times we go back. People see their chiropractor not because they're in pain, but because they notice the body works better.
Yes.
It functions better.
Yes.
Okay. That it's not that they want to be free of pain, it's they want to be healthy. Now, Reach designed from a blueprint that provides a template for vibrant health. The degree to which we reflect the blueprint is determined by the quality and the quantity of care that we provide for our bodies. And that blueprint is primarily our spine. It's not the only blueprint, but it's the primary blueprint. If subluxations are present, this blueprint is altered, your vibrant health is diminished, and here's the result: accelerated aging.
Yeah.
Okay, so when I do my talk on the science behind chiropractic, I talk about a really interesting study that showed all of this. I won't get into that now, but when your nervous system doesn't work right, when you're subluxated, your body ages faster, and there's really good research showing that now. So let's just talk about things that we do to stay healthy. So when you exercise, we don't exercise today so we don't have a heart attack tomorrow. We exercise because it makes our whole body function better. I mean, if you want to, even like your GI system, you want your GI system to work better, exercise. Exercise really helps your GI, but it helps a lot of other things too. And it enhances the meals you eat. You feel better about eating food, I think. At least I do when I exercise. We don't fix our brain so we don't get a headache, but we work on our brains because reading and using our brains actually helps it from deteriorating. Okay, and we have studies on that, like learning to play a musical instrument keeps your brain sharp. Reading keeps your brain sharp. Things like that. So that brings us to lifetime care, and there's a lot of people that don't engage in this, and I meet people like this. So we're a minority, and it's a minority of people that decide to take care of themselves regardless of how they feel. Okay, it takes a certain level of evolved thinking to realize you don't just respond when there's a crisis. And here's a couple of examples. We don't wait till the IRS padlocks our door before we respond to their letters. Okay, we don't wait till we have a heart attack, or we shouldn't, before we take care of our heart. So let's look at important point number 2. Lifetime care is not an outcome, but a never-ending process that we're engaged in. So anything that applies to the virtue of existence is a process and not an end result. Now, before I throw them all up there, how many can think of some things that are like that? It just doesn't end. It's a process.
Yeah.
Jason?
Yeah, showering.
Yeah, that's pretty basic.
Yeah.
So you don't stop at 30 and say, well, I'm done with showering.
Just going to get dirty again.
Yeah, so that would be one. Anybody else?
Relationships.
Yeah, relationships, right. Loving your family. You don't stop loving your family at 50, and say, well, I'm done with that, How about like things like brushing your teeth?
Yes.
Yeah.
Yes.
Let's see. What did I do here? Okay. So exercising, it's a process, okay? Eating the right food, eating healthy food. Now, if you fall off the wagon, for a day, that's not going to kill you. Okay, you may regret it just by the way you feel, but it's not the end of the world. But if you fall off the wagon for a year and a half, there are some consequences for that. Okay.
Well, going back to that, there's consequences when you start going to chiropractic. All those years that you run your body down and you've not taken care of yourself, it takes a while to get it taken care of through chiropractic.
Yeah, because sometimes it takes a while to turn the aircraft carrier.
Yeah.
It does. So brushing your teeth, that's a process. Praying, loving your family. Those are all things that and you could probably think of a lot more. Those are all things that we're never going to be done with. Okay? Now, some people, when they start chiropractic care, hear stories that you have to go for the rest of your life. Well, you don't have to. You don't. You can stop when the pain's gone, and I'm not going to, berate you for that. But people keep going because, like I said earlier, they're healthier. And if you stop, let's say you say, okay, I'm going to go until I don't feel any more pain. That's fine. Okay, you can do that. You think that pain might come back eventually if you don't?
Yes.
Okay. Yeah, very good chance it could. Okay, eventually down the road. Okay, so this is, I'll call this Sally. This is a patient of mine, and I really like this story a lot. This is a young lady that was in a car accident. She came to see me, and she saw me for 3 months. I treated her for 3 months, and at the end of 3 months, we're having this conversation, and she goes, I want to ask you a question. She says, before this car accident, she says, I was having a lot of problems with my menstrual cycles, painful, and they were irregular. And she says, since I've been seeing you for 3 months, they're normal now. Do you think that's a coincidence? Let me ask you guys, is it?
No.
Okay. No. Okay. So what would cause her cycles to normalize under chiropractic care? What would cause that? So you're saying it's not a coincidence.
It's not a coincidence.
But what's the cause? Why would it?
Subluxation.
I was going to say something in the spine,
Okay. Yeah, that's right. And causing what?
causing the systems to be off track.
What system?
Reproductive.
Anybody hear of the autonomic nervous system?
Oh yeah.
Which controls all of our organs, sympathetic, parasympathetic,
Mhm.
all hooked into the spine like an electrical switchboard, okay? So as our autonomic nervous system started working again, but it took 3 months to get it there, okay? It didn't happen overnight. So let's look at important point number 3. Caring for your body and your health is something you do at certain moments and not at other moments, okay? How many would agree or disagree with this? How many would agree with it? That it's something you do at certain moments and not at other
no.
moments?
Oh no. No. It's
Nobody
ongoing.
agrees with it.
No.
It's how many would think it's something you do all the time?
All the time.
Okay, yeah, I would agree with that too. So we render care to ourselves at every moment, really. Think of what we think about. So Hans Selye, anybody ever heard of him?
No.
He's the
Yeah,
guy.
I'm watching this.
He's a physiologist who developed the whole concept of stress and how it affects the body. Very famous. He was just in the 1940s. Okay. So he said adopting the right attitude can convert a negative stress into a positive one. He was the one that did the tests on animals and measured how stress affected these animals. Okay, and what he found was that stressful thoughts grow cancer faster. Now that was pretty radical back in the 40s. And I'll say this: people have been investigating cancer for a long time. If you go back, and I'm getting a little off track here, but I'll get back on. Okay, the Nazis back in Nazi Germany were intensely investigating the causes of cancer. Intensely. Okay, Hitler's mother died of cancer, and he was very, very interested in finding the cures for the cause of cancer. And I do a whole talk on cancer, and I'll get into that. That's going to be later on this year. But what they didn't know then is that our thoughts affect it. Now, today it's accepted that the thoughts can accelerate disease. Bad thoughts can accelerate, negative thinking can accelerate disease. But back in the time of Selye, he's really persecuted for that. Now, let's get another one. Reiki Hamer. I really like this guy a lot. He's a German physician. In the 1980s, around 1980, he had a son that was murdered. And now he'd been a healthy guy up until then. And 6 months after his son was murdered, he developed testicular cancer. And he thought, now wait a minute. Obviously he was really, grieved, and who wouldn't be when their kid, a child's murdered.
Exactly.
So he realized, he got to the point where he realized that there was a connection between what happened to his son and what was happening to him. There's an emotional connection. And so he started looking up his patients' records and found that every cancer that they had, and looked at their history, that there's always some sort of emotional trauma that was causing or associated with the cancers in his patients. And so what he did, he took it a step farther, and he looked at MRI scans of the brain, and he found that there's always a problem in a specific area of the brain that paired with a specific emotion that also paired with a specific cancer, and he was able to nail that literally 100% of the time. And what he found was lung disease was grief or sorrow, stomach and small intestine was indigestible anger, and liver was starvation of love. Now I have a whole sheet of these that goes through all of them, but these are some of them. But Selye was persecuted in Germany for this, because this was not traditional medicine, and he lost his license for a while. It's a long story, but anyway, we render care to ourselves all the time. Okay, the beverages we choose to drink, whether we not choose to exercise, the food we choose to eat, how much we chew our food. Now I've got an issue there. My wife would tell you that. So how much we chew our food, I need to do that better. Okay, whether we smoke cigarettes, whether we drink to extreme, whether we have limited sugar or too much sugar, whether we consume artificial sweeteners which are known to damage the nervous system, So are we rendering care to our body every living and breathing second? What about when we sleep? So how about if you go to bed mad? What do you think percolates in your mind all night, you know?
Yeah.
Not good,
Mm-mm.
all right? So so when we sleep, it's better to go to bed happy or go to bed, you know, with a good attitude.
Yeah.
Because, you know, that's gonna percolate in your mind all night long. So lifetime care is not a choice. The only choice we have is how we're going to engage in lifetime care. So for the friend that says to you, are you still going back to that chiropractor? No, or they say chiropractor. The question should be, are you continuing to make greater improvements in the type of care that you're giving yourself? And I have friends, good friends of mine that are real, they're like kind of like I am, and we talk about that all the time. You know, what are you doing in your workout? You know, what are you eating these days? What do you know? And because we're always trying to get better at what we do. So I want to talk a little bit about the coronavirus because this has become it's become a part of our culture. Okay, so what are the things that can make us more or less susceptible to coronavirus that we can control? Well, there's nutrient deficiencies. So there's some nutrient deficiencies which make our immune system weaker and make viruses stronger. Okay, so let's look at some key nutrients. One of them is ionized calcium. Now, I'm going to do a talk later on this year just on the coronavirus and the physiology of what kills it, okay? But one of the things it does is ionized calcium. The kind of calcium you take is really important. So a lot of the calcium in the vitamins you buy is not very good. It's like calcium carbonate is very, very difficult to ionize in the body. But ionizable calcium, like calcium lactate, most easiest calcium to ionize in the body is calcium lactate. Your body uses, your immune system uses calcium, ionized calcium, to kill viruses, okay? Your white blood cells use ionized calcium. Vitamin C, very antiviral, decreases susceptibility of getting infection, increases white cell count. Viruses deplete vitamin C, but vitamin C upregulates what we call killer cells and interferon. So the whole food vitamin C complex, really, really important in our health. Vitamin E builds resistance to viruses. What's a pretty good, vitamin E is a fat soluble vitamin. What's a pretty good source of vitamin E? Anybody?
Blueberries?
I wouldn't go blueberries. How about egg yolks are pretty good?
Oh.
Okay.
Nuts?
Nuts, pretty good, right, good. And actually whole grains, if you're not intolerant to them, okay. Selenium, very powerful antioxidant necessarily for healthy thyroid function. Zinc, very important. And how many of you heard about, zinc was important in killing the corona? Yeah, yeah, it is.
Yeah.
Vitamin A, very important to immune and thyroid function. And vitamin D modulates the immune system. People with low vitamin D don't have an immune system that works like it should. I can show you at least 5 papers that have come out in the last 2 years that show there's a direct correlation between somebody's vitamin D and how serious, or whether they even got the coronavirus or not. So that's really important. So gut bacteria plays a really, really important part. I'm really, I try and take care of my gut bacteria really well because it's so important for the immune system. 80% of the immune system is in your gut, 80%. So if your gut bacteria has been destroyed by what? Antibiotics, chemotherapy drugs, steroids, and other drugs. And next time I do this talk, we're going to do the side effects of over-the-counter drugs. I'm going to show you which OTCs destroy gut bacteria, because they do. They break down our immune system, okay? And so taking care of your gut bacteria, really important. Stress increases our susceptibility to viruses. It weakens the adrenal glands, so managing stress, really important. So the chiropractic adjustment is still the fastest and most efficient way that I know of to stimulate the immune system. It does it almost instantaneously. What about rendering care to children? So chiropractic care, lifetime care is really good for kids, okay? You don't need to do a lot with them. And I see whole families and the parents tell me that their kids are just a lot healthier when they come to see me once a month. So my request to you as your doctor of chiropractic is that you do your spinal exercises, your neck exercises, okay? And you know, we talk about this a lot during my report of findings. It's really important that we bring that curve back in your neck if we can, because what happens, the spinal cord follows the curve. So when the curve is stretching the spinal cord can't work as well. Okay, so bringing the curve back into your neck, really important. Workplace ergonomics is also important. So here's another thing that a lot of people don't realize. When we don't use our ligaments properly, like exercising is a good way to do it. What happens is they tend to fibrose over time. They get real hard and stiff, okay? So adjusting, when I give you an adjustment, that really helps with the ligaments and keeping those ligaments supple. And so they repair a lot easier. When you exercise, you use them right, and you get adjusted regularly. Now, some people have a habit of going from health tragedy to health tragedy. That is a form of lifetime care, and I know people who do that.
Right.
If that's the way you think about lifetime care, you're going to be real frustrated in my office, because that's not how we do things here. Okay, we encourage lifetime care based on wisdom, deliberately engaging in activities that really have virtue to our health. So our society would you say our society gives us a lot of confusing messages on health?
Definitely.
Yeah. What are some of them?
Eggs are good, eggs are bad.
Yeah.
Butter's good, butter's bad.
Yeah.
Steak is good, steak is bad.
Yeah, that's pretty good. You could keep going on and on and on and on, couldn't you? Okay. So that's why I have these talks, because I want to clear up some of that for people. I want to clear up some of the confusion here, so that you can get a lot better idea of what does work and what doesn't, at least as far as the scientific literature goes. So I'm not here to necessarily treat how you feel, but to make sure that your brain and your spinal cord are operating to the greatest capacity that they can. Now, is how you feel important? Yeah, it is. You know, I mean, if you come here with severe pain, I want to get you out of that, because nobody likes that. But ultimately, it's to get your central nervous system working the best it can. Now, that doesn't mean that you'll never be in pain again if you come here, okay? What it does mean is that you're going to repair better, and when you do have another incident, you won't last as long, okay? You'll get well faster, more efficiently. You spent 30 years developing the problem you came in with. It's not going to happen overnight. It may not take 30 years, but it won't happen overnight. So my prayer for you is that you continue to have a lifetime committed to be informed and sensible. But what happens if you have a medical crisis? I mean, and sometimes that can happen to people. So here's my advice of what to tell your physician. Look, I know these drugs you're giving me are both good for me and they're bad for me at the same time. So I want to work with you to get off of these as quickly as possible.
Amen.
That would be my conversation with the physician. I'm not against all drugs. I mean, all the time. I'm not against all surgery or by any means. I think that we're over medicated in this country, really over medicated. But I'm not against them all the time. But if you have a medical crisis and you need pharmaceuticals, then you need to have a conversation with your doctor about when can we get off of these. You know, I don't want to take them for the rest of my life.
Yeah.
So, now in the next 2 weeks, we're having Patient Appreciation Day, and what we're going to be doing is just offering complimentary subluxation checks to people. And most of you know people that are unhealthy, that you know aren't doing well, and so we're going to be offering just complimentary subluxation checks. Now, you all know people like that. You know, the people you know may be good fit for our office, they may not be a good fit. You know, not everybody is, okay? But they should at least get the opportunity to get checked. At least get checked for subluxations and see if there's a chance that we can help them. And so you can make an appointment with Carmen. She will make an appointment for your friends over the next couple weeks if they want to come in, and we can just check them. And we do it at our expense, and we'll see if we can help them. If we can, great. If we can't, then we'll try and get them to some place that can help them, you know? So all we want to do is give people the opportunity to live a better, healthier life. That's all we want to do here. And so we're doing a Patient Appreciation Day in a couple weeks. It'll be on a Wednesday. We'll probably have some vegetable, well, probably fruit and yogurt and some other things. You know, I'm not going to have any donuts, okay? Some offices do, but mine ain't going to do that. So we'll have try and have some healthy things out here for you. So, any questions of anything I've gone over? Okay, clear as mud. All right. So thanks so much for coming tonight. I really appreciate it. We're going to do the side effects of over-the-counter medication in 2 weeks, and then we got a whole new schedule for the next 6 months after that. So thank you very much. Appreciate
Thank you.
coming tonight. Yeah.
Good job.